Impact of endoscopy system, high definition, and virtual chromoendoscopy in daily routine colonoscopy, a randomized trial. Introduction. Colonoscopy is considered the gold standard for detecting polyps. However, lesions can be missed and may become interval carcinomas. The miss rate ranges from 2% for large adenomas, greater than 10 millimeters, to 26% for very small adenomas, 1 to 5 millimeters. Carcinomas are estimated to be missed in 2% to 6% of patients during routine colonoscopy. It has been known that early detection of adenomatous polyps leads to decreased mortality from colorectal cancer. A recent prospective cohort study confirmed that an increased adenoma detection rate, ADR, is associated with a reduced risk of interval colorectal cancer. Over recent years, a number of new endoscopic imaging modalities have been introduced that provide a theoretical advantage in detection of mucosal lesions such as polyps. This is achieved by altering the light wavelength in order to enhance the visibility of superficial structures. Narrowband Imaging, NBI, Olympus, Tokyo, Japan, involves selective use of certain wavelengths of the visible light spectrum, wherein a shift in the excitation spectrum to blue light takes place in combination with a higher intensity of the blue bandwidth. As a result, light penetrates less deeply into the intestinal wall, affording better visualization of mainly superficial mucosal structures, such as irregularities and polyps, and the small superficial blood vessels, which are a first sign of neoplasia. Multiband imaging or flexible spectral imaging color enhancement, FICE, Fujinon Corp., Saitama, Japan, is based on a similar principle to NBI, wherein post-hoc computer algorithms are used to filter certain wavelengths from the endoscopic image. The Pentax eye-scan system, Pentax Medical, Tokyo, Japan, is based on an adaptation of the superficial contrast, so-called surface enhancement, and, similarly to FICE, a post-hoc modification of certain wavelengths of the reflected light. A specific C mode is available for use in the colon. Fujinon and Pentax use charge-coupled devices with megapixel resolution of 1.3 million and 1.4 million pixels, respectively. Olympus, however, opted for a higher video resolution based on the high-definition television. Theoretically, smaller lesions with a smaller dot resolution should be more easily detected using the above-mentioned type of virtual chromoendoscopy compared with conventional white light colonoscopy. Meta-analysis shows that NBI might be better than conventional colonoscopy in detecting colorectal polyps and adenomas. However, no difference in polyp or adenoma detection was observed between high-definition white light colonoscopy and high-definition NBI. Similarly, FICE and iScan could also not demonstrate improvement in ADR. Other drawbacks are existence of a learning curve and the time-consuming aspect of chromoendoscopy, hampering its routine use in daily practice. As the different modalities, white light, virtual chromoendoscopy, and high-definition versions, have not been compared head-to-head in a prospective way, the authors aim to investigate their influence on ADR in a prospective randomized parallel study in a patient population referred for colonoscopy in a large tertiary hospital. Background. To improve detection of mucosal lesions during colonoscopy, a number of imaging modalities have been suggested, including high-definition and virtual chromoendoscopy. Given the theoretical advantage of these new imaging techniques, the authors aimed to investigate their use for detection of polyps in patients referred for colonoscopy in a large tertiary hospital. Methods. Demographic, endoscopic, and histological data from 1,855 consecutive patients undergoing colonoscopy were collected prospectively. Patients were randomly assigned to 3 endoscopy systems, Fujinon, Olympus, or Pentax, in combination with 4 modalities: conventional white light colonoscopy, N equal 505, high-definition white light colonoscopy, N equal 582, virtual chromoendoscopy, N equal 285, and high-definition virtual chromoendoscopy, N equal 483. Results. The mean adenoma detection rate, ADR, was 34.9%, and the adenoma per colonoscopy rate, APCR, was 2.1. No significant differences were noted between the 3 endoscopy systems. Moreover, no differences in ADR or APCR were observed between the 4 imaging modalities. High-definition white light colonoscopy resulted in a significantly higher detection of sessile serrated adenomas, 8.2% versus 3.8%, p less than 0.01, and adenocarcinomas, 2.6% versus 0.5%, p less than 0.05, compared with the conventional procedure. Conclusions. No significant differences in ADR or APCR between different endoscopy systems, high-definition and/or virtual chromoendoscopy, could be observed in routine colonoscopies in the general population. High-definition endoscopy was associated with a significantly higher detection rate for serrated adenomas and adenocarcinomas.